Hey guys, can you all see me and hear me now? Just give me quick confirmation if I am live. As always, I always face some issue while getting live on YouTube. Today was the same, but hopefully no more issues. Uh, can you all see me and hear me now? Yeah, I cannot see myself, just waiting. Yeah, I think we're live. All right, so welcome to this new series. One more three-letter codon which I have put myself in is gonna be must-know images. So in the next 15 or 20 odd days, we shall be looking at the must-know images of the 19 subjects. We are starting off with micro, and you get a lot of images from microbiology, right? So that is why we started with this and not radiology. We've seen a lot of images, so we'll do it like towards the very end. For those of you who've come here for the first time, my name is Dr Zainab, and I've done my MBBS from AIIMS, followed by MD radiology from AIIMS, followed by SRship from AIIMS New Delhi. So hopefully today will be well, and YouTube will cooperate with me. So before we begin with this, just a quick update on what's been going on Unacademy. So there's a mock test for the FMG students, which is going to be there on 18th of December. So on Sunday, you will be having two papers of 150 questions. So do make it a point to attempt it if you are appearing for FMG. For this is ending today at 12 o'clock. So those of you are looking to subscribe can do that for rupees 10k. After this offer is gonna end. And we also have the final summit batch, which has three modules. The first module, which is in December, is on emergency room, followed by forgotten topics in January, and then most expected questions in February. This is going to be for 3 months, and this also starts today. So you can make sure you're subscribing it. Otherwise, you have prof-wise subscriptions as well, which are available. Okay. All right. The duration of this class will be somewhere around 50 to 60 minutes. Yeah, let's target 50 minutes and then we'll see how it goes. All right, so we'll look at the images and I'll tell you what are the salient features that you need to remember. So we're starting off with a very important image. Do tell me what you think this is, and I'll read your comments, and simultaneously we'll start learning. So these are belonging to which bacteria first of all, and what are these colonies called? Oops. Yeah, these are the Drotsmen, or the no, not don't look at the camp test. Look at the colonies first. Every slide will have a couple of images. So tell me the first on the right if you look at it from radiology point of view, left if you look at it from left point of view. So these are the Drotsmen or the carom coin colonies, right? Can you tell me where do we see these? So these are Drotsmen or carom coin colonies. Yeah, and where do we see them? We see them with S. pneumoniae, isn't it? Why with S. pneumoniae? Because S. pneumoniae has a toxin called optolysin, and that is responsible for the appearance that you are seeing here. In addition, for S. pneumoniae or pneumococcus, very, very important what you want to remember, these are diplococci in a lanceolate shape with a capsule, very important capsule, which is a polysaccharide capsule. Remember, all bacteria have a polysaccharide capsule except which bacteria which has a polypeptide capsule, which is a poly D-glutamate capsule, that is Bacillus anthracis. All right, so I keep telling you points with the images, so it just won't be the images, it will be almost like a rapid revision of the entire subject. So that is what I want from you guys, right? That we revise the entire subject, and this acts as a high yield revision for you. Yeah, so that correctly is Bacillus anthracis, as all of you are saying. And this polysaccharide capsule also produces a very important reaction called the quelling reaction. Okay, so that is also something that you want to remember. And from optolysin also I want you to remember that S. pneumoniae is optocin sensitive and bile soluble. All right, so this is again something which has been tested a lot. Okay, so this is about S. pneumoniae, the most common cause of lobar pneumonia. Okay, on the other side we have the camp test. What is the camp test? So in the center we inoculate staph aureus, right? We inoculate staph aureus, and what is this bacteria which is going to show a positive camp test? It is going to be, yes, group B strep, or also called as S. agalacti. All right, and from GBS, Group B. You want to remember babies. All right. From Group B, from today onwards, we remember babies. And from babies, we remember that babies are very resistant. Okay. So babies are very resistant to stuff, you know. They are very resilient also. Trauma bhi hoga to babies ko zyada fracture kyun hota? They have scivora. What is scivora? Scivora is spinal cord injury without obvious radiological abnormality. So they do not have bone injury, they have spinal cord injury, you know. So anyways, so that is about babies being resistant. So why babies are resistant in this case, the mnemonic is that group B strep are basically bacitracin resistant and they are PYR negative. So when we take something from babies, remember, have to give them something. तो अगर आप उनको bacitracin resistance और PYR negative दे रहे हो, we gotta give them camp positive. And along with camp positive, we also give them that they are gonna hydrolyze hippurate. All right, so hippurate hydrolysis is positive. Very, very important micro facts about group B strep. Okay, so this is about camp test being positive. Basically, these group B strep have a camp factor which will enhance this hemolysis. All right, so this enhance the hemolysis on the blood agar, and that is the camp test. Can somebody tell me where do we see the reverse camp test? Reverse camp test किस bacteria में मिलेगा? The reverse camp test is going to be seen in Clostridium. Yeah, so remember Clostridium perfringens is going to show you a reverse camp test. Okay, and one more very important fact, group B strep is gonna be a very important cause, in fact the most common cause of early onset neonatal meningitis, early onset neonatal sepsis, because it's the mother's vaginal flora which leads to this. So it's gonna be early onset, right? So that is why babies, group B was not just babies, it was babies because it also causes neonatal sepsis. Okay, so this is about this. Then going on to infective endocarditis, let's correlate medicine with microbiology. So this is a very important image from Robbins, yeah, medicine path, all of the integration. So infective endocarditis, very, very quickly, let's just integrate everything here. So what are these 4 vegetations that you are seeing? So the approach to this, this session will be available later. So just see, these are these small warty along the line of closure. So there are 2. First and image 3, which show you these warty vegetations only along line of closure, not going anywhere else. So ये हमारा पहला approach होगा. When I see they are along the line of closure and they're very tiny. This is rheumatic heart disease. Yeah, so this is a gross specimen which is also showing you very firm warty vegetations along the line of closure. Similarly, the third image. What is the third image that you are seeing here? Warty along the line of closure. This is non-bacterial thrombotic endocarditis, also called as marantic endocarditis, which is a paraneoplastic syndrome, right? Associated with GI adenocarcinomas, remember. So GI के adeno-CAs, pancreatic adeno-CAs से associated होता है. The second one, which is tearing the cauda tendini only, it is so aggressive, it is tearing it, it's causing ring abscesses. So this is why we are studying it in micro, because this is infective endocarditis. And what do we see here? When it goes ulta, it's seen on both the sides. This is SLE, and from SLE only you remember this name, which is LSE, Libman-Sachs endocarditis. So just remember SLE, LSE ulta ho raha hai. So vegetations also ulta hote hain. They are also seen on the under surface of the cauda tendini. Why are we discussing this, ma'am, in micro? We're discussing this in micro because we want to do the one-liners here itself, okay? Some part is getting cut. Oh, can I change this? Should I take the risk of doing this? Never mind, let's not take the risk. Okay, yeah, most common cause in IV drug user or hospital acquired or acute. What should be the answer? Whenever you see khatarnak kind of endocarditis, khatarnak means dangerous. Acute ho raha hai, hospital acquired, IV drug abusers. The most common cause is going to be staph aureus. It's going to be staph aureus. Whenever we see community acquired, it's going to be S. viridans. So kabhi bhi suno benign sa, not very benign, but subacute endocarditis community se mila hai S. viridans. Prosthetic wall, think cons. Cons is coagulase negative staph. So coagulase negative staph is S. epidermidis. Why this? Because this produces biofilms. Remember 3 bacteria or 4 bacteria which produce biofilms, very important. One is cons, okay. Second is this guy itself, S. viridans, also produces biofilms. Pseudomonas produces biofilms, that is why cystic fibrosis में होता है. Burkholderia, again cystic fibrosis, more specific infection, produces biofilms. Alright, तो ये हमारे 4 biofilms वाले हैं. And last one, which is somehow not coming up only in the slide, is most common. Oh, see, can you see? Most common cause in CA colon. Most common cause in CA colon is S. bovis. Alright, it is S. bovis, also called as S. gallo galolyticus. All right, S. galolyticus. So this is what I have written here. This is the most common cause. Very important USMLE question. All right, so these are the things which are infective endocarditis. Okay, so let's go back to micro from a path detour. Now going on to this very, very important FMG favorite. Those of you here are attempting FMG, this almost gets asked all the time. So what are we talking about? We're talking about Corynebacterium. Corynebacterium diphthery. All right, Corynebacterium diphthery, remember, has a Chinese letter, Chinese pattern arrangement. Chinese letter से एक और बात याद रखो, fibrous dysplasia. All right, so fibrous dysplasia का bone histopath also shows you Chinese letter arrangement. So Chinese से दो चीजें याद आना चाहिए, ठीक है? Then coming back to this, what is this? This is the volutin granules. So these are the volutin granules, which are basically also called as metachromatic granules, Babes Ernst granules, है ना? तो ये सारे इसके नाम हैं. And what is this stain? Can somebody tell me? हाँ, ये stain कोई बताएगा कि ये granules किस में मिल रहे हैं हमें? This is the very, very famous question. This is the Albert stain. Wonderful. So ये है Albert stain, and then this is the membrane, pseudomembrane that you see here in diphtheria, which is a very, very classical feature. And what they have been asking is the same girl. This same girl comes in every exam who has this bull's neck, because nowadays you don't find a lot of other girls or boys with diphtheria, right? Because it is obviously a vaccine preventable disease, right? So this is the same famous girl who comes in every exam. Okay, so this is the bull's neck and the membrane which is seen in diphtheria, and Corynebacterium diphthery is basically very dangerous because of its toxin. Rather than anything else, it's the toxin, DT toxin, which is the most dangerous, and the toxin is something which is going to be acting via what mechanism? It inhibits elongation factor 2. So it inhibits protein synthesis, it inhibits elongation factor 2. Who will tell me which other bacteria also acts by this mechanism? Very, very, very important. Which other bacteria is going to act by this mechanism? Is Pseudomonas. Remember, Pseudomonas exotoxin A. Both of these are going to inhibit elongation factor 2. In total, there are only 3 bacteria which inhibit protein synthesis. दो तो ये हो गए. The third one is Shigella. Shigella or Shiga-like toxin of E. coli also inhibit the ribosome, right? वो 60S ribosome को inhibit करते हैं, and they inhibit protein synthesis. So remember, toxin mechanisms very important. 3 inhibit protein synthesis. Wonderful. आगे जाते हैं. Extremely important. We did talk about it that this is an exception wherein it has a polyglutamate capsule. This is Bacillus anthracis. So you can see how here we are seeing these gram staining, and the colonies look like what? What is this appearance? This is called as bamboo stick, and there is this filling defect kind of a thing. Yeah, so you can take radio out of a radiologist, but you can put micro inside a radiologist, but you can't take out radiology out of a radiologist, was the sentence I was going for. So this is bamboo stick, and these filling defects that you are seeing here are the central spores in Bacillus anthracis. All right, so this is what you need to remember. Apart from that, what you are seeing here is the gelatin swab, and this gelatin swab is showing you an inverted fir tree appearance. Why inverted fir tree? Because we are having, this is an aerobic bacteria, right? Aerobic bacteria, इसलिए इसका growth ऊपर होएगा, right? It's gonna come up. So this is, it will not be deleted, don't worry. So this is the inverted fir tree appearance of gelatin swab. And what are these colonies called? Very, very famous. It has hair like medusa, right? So this is the medusa head appearance of the colonies of Bacillus anthracis. Okay, I hope everybody you are fine. So this is about Bacillus anthracis. Then going ahead to the next one. So what we are seeing here are Clostridium. So we can see that this is Clostridium, and this appearance has been asked a lot of times. This is gas gangrene. They'll also give you a radiology image wherein you can see in an X-ray or a CT that there is air in the subcutaneous and intramuscular plane. All right, black air dikhega. So this is gas gangrene, and the colony, the bacteria we are talking about is Clostridium perfringens. Clostridium perfringens has a very deadly toxin which is called as alpha toxin or lecithin. Yeah, so alpha toxin, phospholecithin is a very deadly toxin. Lecithinase, yes, because when I do this Naegler's reaction, Naegler's test, what's gonna happen is, that it's gonna lyse this egg yolk. We basically have egg yolk here, right? So egg yolk होता है जिससे वो lysis हो जाएगा. So this is the alpha toxin phospholecithinase or phospholipase A that you have here, which is why you have the Nagler's reaction. Okay, so this is about Clostridium perfringens. On the other hand, what you have here, again a radiology image, you can see how the colon is thickened, right? Colon ekdam thickened hai. This is pseudomembranous enterocolitis. In fact, in a colonoscopy appearance, you will see membranes, obviously, right? So this is pseudomembranous enterocolitis. This appearance is called what? What is this appearance? It looks like a musical instrument, handheld harmonium jaisa ye dikhta hai, which is called as the accordion sign. All right, this is called as accordion sign. And what you see here is a volcano-like appearance, like, so this is like a volcano-like appearance because you see that it is so inflamed that there are all of these inflamed neutrophils and inflammatory cells which are coming out like a membrane. Very important, what is the bacteria we're talking about? So we're talking about Clostridium difficile, and it acts via toxins again. So it has enterotoxin A, enterotoxin B. Enterotoxin A, the toxin A is basically the enterotoxin and B is the cytotoxin part. All right, so you need to know the actions of both of these. So this is about Clostridium difficile. We can use oral vancomycin, we can use fidaxomicin for its treatment. Okay, going ahead into these gram-negative diplococci. So whenever you see neutrophils with gram-negative diplococci, they're giving you history of cervicitis or urethritis or scrotal swelling. You want to think of gonorrhea, right? So this is Neisseria, gonorrhea that we are talking about. These are going to be intracellular. The other differential, Dr. Khan, is going to be chlamydia, but chlamydia will not show you these bacteria. They will only show you neutrophils. Okay, so remember, you will not see intracellular bacteria there. All right, so this is definitely N. gonococcus or Neisseria gonorrhea, and what I'm showing you here is a complication of PID because of gonorrhea or chlamydia. This is basically Fitzgerald-Curtis-Hughes syndrome. So this is Fitzgerald-Curtis-Hughes syndrome, which will have these violin string adhesions. All right, it will have these violin string adhesions, which is perihepatitis. Okay, extremely important. And because we're talking about Neisseria, extremely important, what you see in this gross image is bilateral adrenal hemorrhage. So what syndrome is this? This is Waterhouse-Friderichsen syndrome. Once in your life, you will attempt this MCQ in one of the exams that you write, wherein they'll give you a history of somebody with very fulminant meningitis who has petechial rash. So whenever you see that somebody has meningitis with petechial rash, always think of Neisseria meningitidis. Okay, so this is the Waterhouse-Friderichsen syndrome, where it causes acute adrenal hemorrhage. Okay, so this is about gonorrhea and meningitis. Okay, going ahead to 4 culture media that are frequently tested. All right, so what we have here is the very famous Mekong Ki Agar. Okay, so this is Mekong Ki Agar that you have here, and Mekong Ki Agar, remember, is a differential medium, yeah, because it separates lactose fermenters into non-lactose fermenters. So the pink ones are lactose fermenters and the yellow one is the non-lactose fermenter. The constituents are Mekong Ki are also asked, so remember the mnemonic plant. All right, so what are the components? We have peptone, we have obviously lactose because that is what we are distinguishing. A for agar, which is usually 2%. N for neutral red, which is your indicator, and T is the differentiator, which is taurocolate, sodium taurocolate. All right, so these are the constituents of Mekong Ki, separating lactose fermenters into non-lactose fermenters. All right, then going into correct, CLED is better for UTI, definitely. All right, because it will also allow other organisms to grow, right? Anyways, what we have here is chocolate agar. Chocolate agar is used for which bacteria? Chocolate agar is used for Haemophilus. Why for Haemophilus? Because Haemophilus needs 2 factors to grow. It needs factor 10 and it needs factor 5, right? So factor 5 is NAD and factor 10 is hematin, right? So it needs factor 5 and factor 10 to grow, and that is what we are seeing here in chocolate agar. Chocolate agar provides both of these. Okay. In addition, we can also do a satellitism test, right? So satellitism test, what we will see is, again, I grow Staph aureus in the center. So this is Staph aureus inoculation, and I see that Haemophilus grows around it, but it doesn't grow anywhere else. Why so? Why satellitism is positive with Staph aureus? Because Staph aureus is providing it with the factor 5. All right. So can you see how there is blood agar in the periphery? Do you think 10 hematine would come from blood? Yeah, sounds like it, right? So factor 10 usko mil raha hai, but it's not getting factor 5 because it's not chocolate agar. So Staph aureus provides it with the factor 5, and that is why here only we can see Haemophilus growing, because it's getting both factor 5 and 10 in this vicinity. I hope you got it. So very famous test. This is satellitism, which is again a property of Haemophilus. Okay. Apart from that, they can give an X-ray with a thumb sign, acute epiglottitis. They can tell you a child who has not been vaccinated is coming to you with a tripod position, cannot breathe, hot potato voice. What will you do next? You will first intubate, because it's a threatened airway, right? So ये बहुत important है. You have to intubate first, after that give antibiotics, and then send for X-ray for thumb test. All right, so clinical scenario based question will come. So this is how you have to study integrating peds, radio, micro. Okay, what do we see here? This is the Dines phenomenon. Dines phenomenon is used for Proteus infection. Remember, Proteus के अगर दो species, two separate species will not merge into each other. They will show this one very thin line of separation. So this is called as the Dines phenomenon for Proteus. Remember, from Proteus, S for swarming motility. It shows your swarming motility. U for urease positive. It is urease positive, and Proteus is responsible for what? It is responsible for struvite or staghorn calculus. Staghorn calculus, remember, please leave PDF means leave and go, or drop it in the Telegram group. I will do that. All right, annotated PDF I will leave. Remember, Proteus will produce these staghorn calculus, okay, which are these large calculus made of ammonium, triple phosphate calculi, and these triple phosphate calculi will give you a coffin lid appearance. All right, they'll give you this coffin lid appearance. Okay, so bas itna yaad rakho about Proteus. Now going ahead into the next one, what is this test called? This is called as Kirby-Bauer disc diffusion test. तो बस ये बस आप याद रख लो, Kirby-Bauer disc diffusion test is used for testing the drug sensitivity or resistance. तो ये काफी like prof में पूछते हैं, isn't it? This is KB disc diffusion test. Then we have the IMVIC test. So IMVIC test, you want to remember the two bacteria that it distinguishes is E. coli and Klebsiella. So E. coli, remember, starts with E, so starts with I. So E. coli के लिए ये दो पॉजिटिव रहेंगे, ये दो नेगेटिव रहेंगे. For Klebsiella, first two will be negative and second two will be positive. So just remember, E vowel stick together, so ये दोनों positive आएंगे. Okay, so that is all that you want to remember about IMVIC. What is this test which I am showing you? Where you see that ऐसा bubbles बन गया. So this is Catalase test. All right, so this is Catalase test. All you got to do is put a peroxide H2O2 का drop डालो. Because of the catalase positivity, it will be broken down into water and oxygen, and you will see these bubbles here. Okay, so this is given by catalase positive organisms. So what are all the catalase positive organisms? All of you, I'm sure, have your own mnemonic. My mnemonic is spaces. So one most important, Staph aureus. Another one, Serratia, and P for Pseudomonas. Why this is a wonderful mnemonic is because we are clubbing three organisms which have one more similarity. Who will tell me what is the similarity between these three? Various variety of bacteria. All three of them have a property that they produce pigments. Staph aureus produces a golden yellow pigment. Serratia produces a red pigment, and Pseudomonas can produce any color that it wants. Okay, so these are the three bacteria which have pigments. All right, going on with the mnemonic, A for Aspergillus, C for Candida, so two fungi which produces this, and E for Enterobacter. Can just remember space because one S I have written here only, Serratia, right? So one mnemonic lesser. So this is space which produce catalase positive. Okay, going ahead into the variety of findings that what can produce, that syphilis can produce, right? So this is primary syphilis which produces this very hard, painless, indurated chancre, right? So this is going to be the primary syphilis. Secondary syphilis, systemic syphilis, can produce a rash which can be any form. It could be any form except two things. Syphilis rash can be morbilliform, rubelliform, whatever it wants, but it will not be vesico-bullous and it will not be itchy. The only two things that a syphilis rash will not be. Apart from that, can it involve hands and palms? Yes, you are showing it. So hands and palms is basically gonna be involved here. Okay, so that is something very important. And there is also one more sign. You get deep dermal tenderness, which is called as the Ollendorff sign. Okay, so deep dermal tenderness milta hai, Ollendorff sign. So this is about syphilitic rash. On the other hand, on the mucus patch, so in the mucosa, we see mucus patches, which are also called as snail track lesions. In the mucosa or in the mucocutaneous junction, you see what? Condyloma acuminata or condyloma lata. What kind of Ollendorff sign? Let me write that. Yeah, condyloma lata or condyloma acuminata. Everybody confuses these. So remember, it is condyloma lata, which you are going to be seeing. So these are going to be flat topped. How do I remember it? Is flat topped, है ना? तो flat के 4 letter है, lata और lata के 4 letter है. Alright, so just remember, lata with syphilis has flat top. Alright, so flat topped lesions होते हैं. Condyloma acuminata, on the other hand, will be the verrucous lesions of HPV. It can produce alopecia, typically described as moth-eaten alopecia. Remember, syphilis alopecia can be scarring as well as non-scarring. In tertiary syphilis, we see gummatous lesions, right? So these are the gummas that you are seeing in tertiary syphilis. Tertiary syphilis, apart from the skin, can involve cardiovascular and neuro involvement. Neuro involvement is called tabes dorsalis. Okay, and what is this? This is dark field microscopy, where you see these corkscrew treponema pallidum. Okay, so dark field microscopy can be done with the ulcer fluid. It can be done with blood. It can be done with CSF. तीनों fluids के साथ dark field can be done. Alright, so we've covered syphilis in a nutshell. Going into mycology very quickly. So all of these fungal stains are very, very important. Okay, so the first one where you are seeing, what is this? This is PAS, right? So remember, fungal hyphae are gonna be PAS positive. What is this? This is a fluorescent stain, which is calcofluor white, and calcofluor white, remember, C for chitin. It stains the chitin in the cell wall of the fungus. What you see here is culture morphology being demonstrated on lactophenol cotton blue. What you see here is gomery methamine silver, blackish colonies, red colonies, muci carmine red. And what you see here is the very, very famous India ink staining of Cryptococcus, right? So this is India ink of Cryptococcus. All of these are repeat questions, very important fungal stains. Now going on to the dimorphic fungi. All right, so 4 dimorphic fungi for endemic mycosis, not endemic to India but endemic to US, but we do get a lot of questions from these. Okay, so the first one is what mimics TB all the time, is what? Is histoplasmosis, also called as Ohio, Mississippi or Darling's disease. Two things remember about dimorphic fungi. What is the principle of dimorphic fungi? That in cold they are mold, right? In cold they will have the moldy form, or basically they will have the hyphae being seen, and in heat they will have the yeast form. All right, so cold is mold, heat is yeast. Cold kahan hoga? Cold is C for culture, right? When you culture them, you see the moldy form, and when you take a histopath, right, in the body, heat, H for histopath, you will see the yeast form. So this is the mnemonic to remember dimorphic fungi. Okay, so these are the 4 dimorphic fungi that you want to remember, and then I'll tell you 2 more. Okay, so what do we see here? We see that in histoplasmosis, in the histopathological appearance, we see these yeasts which are intracellular. So you're going to be seeing these intracellular within the macrophages. These are the yeast form. And in the culture, you are seeing what kind of conidia? These are called as tuberculate macroconidia. So see how it's related to TB, उसके नाम में भी हमने डाल दिया tuberculate macroconidia. All right, so this is about histoplasmosis. Two things, intracellular yeast form मिलेगा and tuberculate macroconidia मिलेगा. Very important, broad based budding. Broad based budding, B for blastomyces, right? So this is blastomyces, blastomycosis, broad based budding, also called as Chicago, North American or Gilchrist disease. Then very important, coccidiomycosis, which will have arthralgias, rheumatism basically, also called as California or valley fever or desert rheumatism, because valley and California. And what do you see? You see these endospores here. You see spherules with endospores, and you see these barrel shaped arthrospores, right? You see these barrel shaped arthrospores, both of which are repeat questions. And finally, for paracoccidio, I am just hiding it, so I will just write it somewhere you can see. So this is paracoccidiomycosis, where you see this captain wheel or this Mickey Mouse sort of an appearance. All right, so these are all of the images from endemic mycosis, which gets asked a lot. All right, so I hope this is clear to all of you. So these are the four dimorphic fungi. For dimorphic fungi, do you want a mnemonic? You can remember HSBC, bank. But it is not bank, it is B, which is actually two P's. Okay, so what are all of the dimorphic fungi? Histoplasma, ब्लास्टोमाइसिस, कॉक्सिडियोमाइकोसिस एंड पैराकॉक्सिडियोमाइकोसिस. दो पी रह गए, एस फॉर स्पोरोथ्राइकोसिस, पी फॉर पेनिसिलियम मार्नेफी. सो लेट्स सी द टू ऑफ देम. व्हाट इज दिस? दिस इज पेनिसिलियम मार्नेफी और टैलरोमाइसिस मार्नेफी. सो इन पेनिसिलियम मार्नेफी, रिमेंबर दिस ब्रूम ब्रश अपीयरेंस, एंड हाउ वी रिमेंबर रेड बैक्टीरिया. रेड बैक्टीरिया कौन है? सिरेशिया. रेड फंगस कौन है? पेनिसिलियम मार्नेफी. दैट इज व्हाट यू वांट टू रिमेंबर. सो पेनिसिलियम और टैलरोमाइसिस, this is broom brush appearance, and also remember that this produces a red pigment, a red colony. Okay, so this is penicillium. And the last one is the favorite question. You cannot get this wrong. FMG exam is just not leaving this question. What do we see here? This is Poro Trichosis. So this is Poro Trichosis. You will see a linear lymphocutaneous lesion in a rose gardener. Farmer hoga, rose gardener hoga. Poro Trichosis, linear lymphocutaneous lesion. Again, rose gardener से ही याद रखो. We see these rosette of conidia here. You see these asteroid bodies here, right? So these are the findings of sporotrichosis. I've kept the other two foot findings because you get asked these a lot, and you need to remember what are the linear cutaneous lesions. So first is sporotrichosis. When you see warty lesions, they tell you this person was walking barefoot. Warty lesions मिल रहे हैं, very important. Yes, this is chromoblastomycosis, and chromoblastomycosis, remember these bodies is the new favorite. This is copper penny bodies, also called as sclerotic bodies, also called as muriform bodies, right? Medullary bodies. तो ये बहुत सारे नाम हैं इस bodies के, but one question which is common all the time. On the other hand, not warty lesions. So Akshay, this is the answer to your question. You see these nodular lesions which are discharging. So discharging sinuses, nodular lesions in the foot. What is this? So this is mycetoma or Madura foot. All right, so Madura foot can be caused by fungus. Yes, it could be Madura mycosis. It could be caused by actinomyces, particularly if they're describing the mandible with discharging sinus, right? It could be actinomyces. And the third differential, remember, is Staph aureus. Very weird, Staph aureus, because it produces botyromycosis. Again, a misnomer. It is a bacteria, but we are calling it botyromycosis. Okay, so these are the three differentials for such an appearance. Actino versus nocardia. Do remember this? Actino versus nocardia. Actin, no. It is saying no. A, no, it is anaerobic. So remember, वो खुद कह रहा है no, not nocardia का no, actino का no, that it is anaerobic and it is not gonna be acid fast. On the other hand, nocardia is acid fast and it is aerobic. All right, both of them are gram positive filamentous structures, so that is why you need to know them. need to know the differences. Going ahead, what do you see here? We see the India ink. We've already seen this. So this is the true yeast form that you are seeing for what? This is Cryptococcus, cryptococcal meningitis. HIV का history दिया होगा, raised opening pressure दिया होगा. Remember, India ink staining, most important test though. This is important for exams, but most important in specific for the exam purpose is the latex agglutination test, right? So this is the card test or the CRAG test that you have. So this is latex agglutination card test for cryptococcal, which is the most sensitive for CSF. On the other hand, two hyphae. So this is true yeast. Now going into true mold forms. So you need to distinguish the hyphae here. When you see acute angle branching, you see septations. So नाम से ही पता चल जाएगा, ASP, acute angle branching, and you see septations which are present. This is Aspergillus. On the other hand, when you see these broad ribbon shaped obtuse angle branching, aseptate, broad ribbon shaped, this is mucor, mycosis or rhizopus basically, right? So this is mucor. All right, so two true hyphae. Okay, going ahead into a pseudo hyphae. What you see here is pseudo hyphae because they are actually budding. It looks like they are hyphae, but it's just the budding that you're seeing here. So this is Candida, which is neither a true yeast, neither a true mold. So this is Candida, the most common species, Candida albicans. What do you see here? This is the Reynolds-Broad's phenomenon, which is showing you germ tube formation. So it shows you germ tube formation. Remember, from Candida, all C's stick together. So Candida is going to give you cottage cheese or curdy discharge. It is going to give you on cornmeal agar, it's going to produce chlamydiospores. And one more C for you, it can be distinguished on a chrome agar, right? So all C's with Candida is what you want to remember. Chrome agar से उसकी species को distinguish कर सकते हैं, which is a repeat question. Okay, so this is about Candida. What you see here, radiology, you can see that there are ground glass opacities in both of the lung fields. On a CT scan, you are seeing the presence of GGOs, ground glass opacity, with cyst. The name itself has cyst. I'm telling you, this patient has HIV/AIDS. The patient is not taking prophylaxis. CD4 count is less than 200. This is PCP, pneumonia, pneumocystis or pneumocystis jerovokai, pneumonia that you are seeing here. So remember, pneumocystis, radiologically you will see cysts and ground glass opacity, and you cannot culture this. What you're gonna see is when you do a bronchoalveolar lavage and you do a Gomery methamine or a silver staining, basically you will see these colonies, or you will see these bacteria which look like, not the bacteria but the fungi, which look like crushed ping pong ball, right? So this is crushed ping pong ball. Thank you. My handwriting is even better actually if I want it to be, but right now I don't want it to be. I will be too slow. If I write pyar se, no, I can write even better. But I think you are used to so bad handwriting that this looks very good. So I have kept your expectations to a very low. So ye bhi acha lag raha hai. So this is PCP. Then we have 3 dermatophytes. Yeah. So there are 3 dermatophytes. Remember, on the basis of the shape of the macroconidia, we have these 3 shapes. All right, so you want to remember PSC, primary sclerosing cholangitis, right? So this is pencil shaped macroconidia, this is spindle shaped conidia, and this is club shaped macroconidia. Where are they seen? So here TME. So T for trichophyton, M for microsporum, and E for epidermophyton. Trichophyton will obviously involve all the tissues, है ना? Trichophyton, है ना? So trichophyton is gonna involve skin, hair and nails. Microsporum is gonna involve skin and hair. Skin सभी involve करेगा. Epidermophyton is gonna involve skin and nail. ठीक है? As far as the microconidia are concerned, just keep on decreasing. In trichophyton बहुत सारे मिलेंगे. Here थोड़े थोड़े मिलेंगे. Here नहीं मिलेंगे. All right, here you will not see any microconidia. Okay, so this is about this thing. Okay, this is about the Dermatophytes. Dermatophytes, talking about the hair. So tinea capitis, very frequently asked when you see that there is this boggy, tender swelling in a child with lymph nodes which are positive. This is going to be chirion. Most common cause of chirion is going to be T. mentagrophyte. Trichophyte or mentagrophyte. On the other hand, when you see such scutula, you see favus, right? So this is favus or scutula, and the most common cause here is going to be Trichophyton Sean Laney. So this is T. Sean Laney. All right. So very frequently asked questions about uh, tinea capitis, and remember both of these are going to produce scarring alopecia, right? Scarring alopecia बनाएंगे. Scarring alopecia के causes याद रखो. One is going to be tinea capitis. Apart from this, we will have DLE, which causes scarring alopecia, and I already told you syphilis can produce both scarring as well as non-scarring alopecia. Okay. Again, derma integration, what you see here, hypo and hyperpigmented lesions. So this is T, versicolor on the KOH mount. On a KOH mount, we are going to be seeing a spaghetti and meatball appearance. Yeah, that is what we will see. And on an SDA agar, you are going to see these egg yolk like colonies. Remember here, for SDA, we need to add olive oil. All right, we need to add olive oil, and the bacteria we are talking about is Malassezia furfur. All right, so this is T versicolor, which is the cause, jiska causative agent is Malassezia furfur. All right, and yes, this is the fried egg colony appearance that you are seeing here. Okay, so this is about this. Going quickly into parasitology. So eggs are very important. So nematodes के eggs ज़्यादातर पूछते हैं. The first one you see is non-bile stained plano-convex egg. This is Enterobius vermicularis, also called as pin worm. All right, so it will cause perianal pruritus. And remember, NIH swab test and scotch tape test. Two tests for this, NIH swab and scotch tape test are done for this. What do you see here? Barrel shaped egg, दोनों तरफ mucus plugs है. This is trichuris, most frequently asked in FMG exam. दोनों तरफ trichuris, trichura. नाम में भी 2 बार trichuris, shape में भी 2 बार mucus plugs. Okay, what do you see here? The largest nematode, जिसके 2 eggs है. So when it is fertilized, like everybody who is fertilized, it will be fat and round. So when you see fat and round, this is fertilized egg of Ascaris. And when you see that it is oval, this is the unfertilized egg. All right, so fertilized and unfertilized egg of Ascaris, the longest nematode. When you see these round blastomeres within the egg, this is hookworm. So hookworm, remember, it could be ankylostoma or Necator. Two species, है ना, old world and new world, ankylostoma and Necator. And hookworm again is non-bile stain, right? So two non-bile stain that we have seen here. And then something where you don't see the egg, it is ovoviviparous. You see the larva. You see the larva here in the stool sample. This is Strongyloides, which is the shortest or the smallest nematode. So this is Strongyloides larva for you here. Going on to the cystodes, what you see here is these radial striations. So this is, what do you see here? So this that you see here, where you have the definite host is human. So remember, in cystodes, the definite host everywhere is going to be humans, and the secondary host will be variable. So yes, in tinea, solium or saginata, basically you cannot distinguish on the basis of the eggs. You have the tinea egg, which could be solium or saginata. Just give me 1 second, okay guys, I'll just be back. Am I back? So this is tinea, solium, tinea saginata. So solium, remember, the secondary host here, or the intermediate host, is going to be pig, whereas here it is going to be cattle. A for saginata, A for cattle. Okay, then going ahead, here again a non-bile stained egg that you see. So here we want to remember chota baby. Nana is chota baby in Gujarati. All right, so that is one Gujarati word all of you should know. So this is H, Nana. From Nana only we want to remember, Nana means dwarf, है ना? So this is dwarf tapeworm, the other name of this. H, Nana. Nana baby, should we give any other host? No, it has only one single host. So this is the only one single host, which is humans here. So this is non-bile stained, and you see these yolk granules, you see these polar filaments here in the egg because you want to protect the chota baby. Okay, so this is H. nana. On the other hand, what claims to be nana but is not nana is H. diminuta. Naam mein to hai diminuta, but no, it is lying. So that is why H. diminuta, it is, we call it, you are a rat tapeworm, you are a liar. So we call it rat tapeworm because obviously its intermediate host is rats. Okay, so this is H. diminuta, it will be bile stained. On the other hand, the only cystode which has an operculum, usually trematode eggs will have operculum, but the only operculated cystode egg is Diphyllobothrium latum, right? So this is D latum, very very important, you guys know it. Fish tapeworm है ना, इसके तीन होस्ट होते हैं. So one first host is definitely humans, intermediate host first is cyclops, and then you have fish. Okay, and this affects the ileum को infect करता है, and that is why it causes vitamin B12 deficiency, because that is where B12 is absorbed. Okay, further going on to 3, schistosoma eggs, extremely important. So schistosoma eggs को याद रखो. So these are again trematodes which have an exception. They don't have operculum, but they have spines. So when you see a lateral spine, remember Schistosoma mansoni. Here you want to think of a girl called Mansi, who's very teddy ladki. So teddy ladki Mansi has a lateral spine, teddy spine. And such people, do they do well in life? No, they are inferior. Okay, so that is inferior mesenteric plexus. No offense to any Mansis out there, alright? This is just S. mansoni. You are a nice girl. Okay, so this is S. mansoni, inferior mesenteric plexus को affect करता है. On the other hand, this is no spine. कोई spine नहीं है, very flexible like Japanese people. So S. japonicum. Okay, S. japonicum, no spine, so very flexible होते हैं Japanese. And also you want to remember, they are doing very well in life, right? Japanese. So there is superior mesenteric plexus. Okay, so both of these Mansoni and Japonicum are gonna be invading the mesenteric plexus. They're gonna be causing portal hypertension, liver fibrosis, and finally you see a terminal spine. So like hematological cancers which are terminal, this is S. hematobium. So terminal spine, S. hematobium. All right, so this is terminal spine. And because hematological cancers are also terminal, remember, you also want to remember, it causes cancer. So it causes squamous cell C of bladder. Yeah, it affects the pelvic plexus. So it affects the vesical plexus, the pelvic plexus, and it causes squamous cell C of bladder, and also causes PH, pulmonary arterial hypertension. All right, so these are all of the causes of schistosoma. Then 3 infections in HIV/AIDS. So in HIV/AIDS we have 3 infections: Cryptosporidium, Cyclospora, Cytoisospora. All of them are acid fast. Okay, so you need to distinguish them on the basis of their size. The size would be given in the question. So when you see 4 to 8 and rounded, that is chota Cryptosporidium. When you see 8 to 10 and round, that is Cyclospora. And when you see sabse bada 10 to 20 micron and it's an oval, this is Isospora. All right, so usually Isospora is asked if they are not mentioning the size. Yeah, these are all gonna, of course, diarrhea. Diarrhea ke causes in HIV/AIDS, think of these 3. Okay, so Cryptosporidium 4 to 8, usse bada 8 to 10, and 10 to 20 Isospora oval. Okay, apart from that, also remember Cryptosporidium will always be acid fast, whereas Cyclospora will be variably acid fast. You will see some acid fast, some not acid fast. Okay, so this is how you can distinguish these 3. Quickly talking about the microfilaria, the worms, and how do you distinguish them on the basis of their head and their tail. So there are 3 who are sheathed. So do you know LBW in cricket? So in LBW, ball pad ko lag ke jata hai, isn't it? So that is how you remember, pad say sheathed. All right, so there are 3 sheathed microfilaria, which is LBW. So 3 sheathed jo ABC dikh raha hai, these are either loa, Brugia malai or Buchereria. So this is the first step. कि 3 sheathed है, बाकी के unsheathed है. All right, so that is how, that's going to be a first step. Second step, within the sheath, ये क्या है? For that we have to look at the tail region and the arrangement of the nuclei. All right, so when you see no nuclei, remember nuclei vanishes. So V for vanish. So this is no nuclei at the tip. This is Buchereria. When you see that there are 2, bi for 2, when you see 2 nuclei, this is or Brugia. And when you see that they are arranged in a line, the nuclei are arranged in a line, that is L for Loa Loa. Okay, so this is how you distinguish within the LBW. In the non-sheathed, the unsheathed microfilaria, how do you approach it? So in the unsheathed, you want to see that there are two where there are no nuclei at the tip, है ना, तो जीरो. सो इनके नाम में ओ आएगा. सो ऑनकोसर्का एंड मानसोनेला ओजाडी, दोनों के टिप में there is zero. All right, so there is zero nuclei at the tip, they will have O. On the other hand, within Mansonella perstans and Streptocerca, remember Streptocerca has S जैसा curve. So this is Streptocerca and this is Mansonella perstans. But very unlikely that they'll ask you on sheath, because these we don't see a lot. What is very important are these three. So usually they can ask you Wuchereria or Brugia, because those are clinically relevant to us. Okay, so this is about microfilaria. Quickly doing the mosquitoes. So what is this mosquito जिसका adult angle पे बैठता है? It's a sophisticated mosquito, clean water है, single egg देता है, spotted wings है. This is Anopheles. On the other hand, two mosquito जिसके angle पे बैठते हैं, जिसके parallel बैठते हैं mosquito, and you see stripes in the body and the legs. This is Aedes, right? This is the tiger mosquito, the Aedes mosquito, which has stripes on the body and legs, and this has the shortest flying range, and this is collecting on artificial water collection. So Anopheles, sophisticated, clean water. On the other hand, last one, Culex. Culex, remember, we will see in dirty water, and this has a hunchback. That is how you'll identify as a hunchback hoga, and this has the highest flying range. And finally, the mosquito which has long legs, and you see with water plant, which is Pistia, that I have written here. This is Mansonia. Alright, so this is Mansonia, which is seen with aquatic plants or Pistia. So ये हो गए mosquito, and साथ साथ if you see mosquito जैसा but ऐसे furry, this is sandfly. Sandfly is the vector of very important Kala Azar. Alright, so Kala Azar, they will give you this image also. So this is the bone marrow with Giemsa stain, and you can see these A mastigotes, and very important, the RK39 antigen test. So Kala Azar, they'll give you somebody from Bihar Jharkhand belt with fever and hepatosplenomegaly, and they'll give you one of these images. Going ahead into parasito, further into the trophozoites, what do we see here? We are seeing entamoeba, right? So we are seeing entamoeba histolytica. Entamoeba histolytica, remember the amoebic ulcer. The amoebic ulcer that you have here is gonna have this kind of an ulcer shape, which is a flask shaped ulcer. Apart from this, what are these two showing? There is one trophozoite and there is one cyst. Which organism am I talking about? Which shows you a fallen leaf motility. This is Giardia, right? So when they ask you which is the only parasitic infection which can cause malabsorption, or the only infection which can cause malabsorption in diarrhea in a traveler, ऐसा history दिया होगा. This is Giardia lamblia. Remember, the trophozoite form will have how many flagella? एक तो कितने न्यूक्लियाई होंगे? It will have 2 nuclei and it will have 8 flagella. So 4 pairs of flagella होंगे in the trophozoites. Very important. 4 pairs पूछ सकते हैं या 8 पूछ सकते हैं, and it has 2 nuclei. All right, and the egg is gonna have, or the cyst is gonna have 4 quadrinucleate. All right, so this is the cyst form, which is the infective form. Remember this. On the other hand, there is another infection which has only trophozoite, no cyst. Who can tell me what is this? दोनों के trophozoite काफी similar लगते हैं, but here you have only 1 nuclei and you have 5 flagella. Total 5 flagella. Okay. All right, you have total 5 flagella. So what is this? Yeah, this is trichomonas, right? So this is trichomonas, strawberry cervix, strawberry vagina, lots of inflammation is what you're gonna be seeing. Quickly talking about malaria and all of the shapes that you're gonna be seeing. So what species of plasmodium are you seeing here? When you see that in the trophozoite form, you are seeing a ring. So here the trophozoite is gonna show you a ring like arrangement, a single ring, and the same species will show you multiple merozoites in the schizont form. Which species are we talking about? We are talking about Plasmodium vivax. Okay. On the other hand, if you see multiple rings or you see these headphones kind of a pattern, this is called as the acole form. And you see these banana shaped gametocytes. Which species are we talking about? We are talking about P. falciparum, right? So this is P. falciparum. Remember in the optimal test that you have, right, the disc test that you have, the card test that you have, very very important in the national program NVBCD, what you have as far as the antigen test goes, for P. falciparum specific we have histidine rich protein 2, whereas the one which is common to both of them is gonna be LDH. All right, so this is also something that you want to remember here. Wonderful. And finally, jo not much we see the band type. When you see this band form here, this is P malaria. All right, so this is P malaria. All right, so this is about malaria. And just to show you RBC inclusion, when you see this Maltese cross appearance, not in urine but Maltese cross appearance in RBC, this is babesiosis, right? So this is babesiosis which has hard tick as a vector. Remember, hard tick इसका vector होता है. बाकी सारे vectors हम PSM में revise कर लेंगे एक बार. Babesiosis, Maltese cross in urine is also seen in Fabry's disease. All right, Fabry's disease and nephrotic syndrome जिसमें lipiduria होता है, दोनों में ही you will see Maltese cross in urine. Okay. Right, going ahead into the shapes of various viruses, quickly wrapping up viruses. So these are the various shapes. When you see a bullet shaped virus, this is basically the rabies virus. When you see these filamentous virus, this is Ebola. Yeah, filovirus है उसका नाम, Ebola. When you see these wheel shapes, this is rotavirus. When you see a box like a brick shaped virus with a dumbbell shaped genome here, this is box for pox. This is pox virus, which has a complex symmetry, right? So this is the largest virus that you have. This has the complex symmetry. What you have here is a spaceship, a space wheel or a spaceship kind of an appearance. This is adenovirus, and this virus has a rod shape. You will not hear of it anywhere else except for its shape, rod shape. Tobacco mosaic virus, TMV, tobacco mosaic virus. And this nobody will forget. I think चलते फिरते को भी पूछ लोगे तो बता ही देगा कि डॉक्टर साहब कोविड कोरोना जैसा लग रहा है. So this is coronavirus which has this corona shape, right, crown shape with this petal shaped pepelomeres. All right, so these are the shapes. Very important inclusion bodies that you need to know. So when you see such umbilicated, can't get this wrong, FMG students का favorite, मतलब examiners का favorite, umbilicated lesions with a central dome, and you see these very large bodies. These are HP bodies, Henderson-Patterson bodies. We are talking about molluscum contagiosum virus, MCV. Okay, very very important. MCV is a type of what virus? DNA virus, RNA virus. This is a DNA virus. This is a pox virus. It is the only pox virus जिसके नाम में pox नहीं आता. So remember this. All right, so very very important. What do you see here? These are the Negri bodies which you see in rabies, and this is the stain, that is the cellular stain that is used here. And along with that, what are the cells which are affected? So two sites you want to remember. You want to remember Purkinje cells in the cerebellum and hippocampal cells, right? So these are the areas which are affected in rabies. What is this? Sexually transmitted infection. You see this perinuclear halo. These are coilocytes which are seen on a pap smear in an HPV infection. Okay, going further, what do you see? These are intranuclear plus intracytoplasmic inclusions. Very very important. A child who has not been vaccinated, having fever and rash which is spreading from cephalocaudal, sparing the palms and soles, and you are having these inclusion bodies. You are having these spots near the molar. So I'm talking about measles, I'm talking about Koplik spots, the pathognomic feature, and these inclusion bodies are Warthin Finkeldy giant cells. Very very important. They have intranuclear plus intracytoplasmic inclusions. Finally, something that reminds you of Hodgkin's lymphoma but is not Reed-Sternberg cells because it is basophilic. So this is basophilic inclusion bodies, again intranuclear plus intracytoplasmic. This is CMV, owl eye inclusion bodies. Okay, going ahead further into all of the findings of which virus? The virus which shows you multinucleated giant cells, it shows you nuclear molding and margination. The three M's. I am talking about herpes simplex virus. HSV ulcers, genital ulcer will show you erythematous painful vesicles. Remember this, right? So this will be recurrent painful vesicles. If it affects the lip, it will cause herpes labialis. So this is HSV1, whereas genital STD, HSV2. Above the diaphragm, HSV1, below the diaphragm, HSV2. And what you see here are the dendritic ulcers, right? So it can produce dendritic ulcers, it can produce encephalitis. So all of these are going to be HSV1K complications. Okay. Further, going into varicella zoster virus, when it reactivates, it's going to produce shingles, and this is going to be along a dermatomal distribution. This image has come a lot of times. Dermatomal rash, very painful post-herpetic neuralgia is the most common complication that you will see here. Apart from that, something very famous in the news, Justin Bieber had it. What am I talking about? Yes, I'm talking about Ramsay Hunt. So when there is basically reactivation and it has been dormant in the geniculate ganglion, when it reactivates, it can produce Bell's palsy. So what you are seeing here in Justin Bieber is the Bell's palsy case sign, and you can also have these vesicles which are pretty painful in the external auditory canal, right? So this is the Ramsay Hunt syndrome. Talking about Epstein-Barr virus, very, very important. Epstein-Barr virus, remember, will produce a picture that will be much like a viral URTI. So it will show you that the patient has runny nose, patient has fever, but there will be hepatosplenomegaly, and you will see that there are posterior cervical lymph nodes. Yeah, so hepatosplenomegaly, posterior cervical lymph nodes are gonna be clues here. One more very typical finding is आपने patient को amox दिया, सोचा patient को तो strep है, you give the patient amoxicillin and the patient will develop this complete morbilliform rash in the body. Very, very typical for infectious mononucleosis. So I'm talking about infectious mono, which is caused by Epstein-Barr virus, also called as kissing disease. So seen in adolescents. And extremely important image, you see this ballerina skirt appearance. So tell me, what are these cells? What lymphocytes are these? Are these B cells or are these T cells? These are actually T cells. These are CD8 cytotoxic T cells. But the irony is Epstein-Barr virus tends to affect the B cells, right? It tends to affect the B cells via what? Via the antigens which are EBNA2 and LMP1. So these are the targets through which it infects the B cells, and that is why Epstein-Barr virus is associated with so many cancers. It's associated with Hodgkin's lymphoma. It is also associated with DLBCL. It is associated with nasopharyngeal CA, right? So many cancers it is associated with. Yeah, so it enters via CD21 receptors. Perfect. And this test that you are seeing, agglutination test, wherein it reacts with sheep or horse RBCs, this is called as monospot test or Paul Bunnell test. Frequently tested. So these are all of the facts you want to know about EBV. Very famous question, slabbed cheek appearance, erythema infectiosum is caused by parvovirus B19. So this is parvovirus B19. It tends to affect the erythroid precursors and it produces this dog ear appearance, right? So remember parvovirus B19, not B12. I don't know what is my relation with this name. So parvovirus B19 is gonna affect cause erythema infectiosum. In addition, it can cause pure red cell aplasia in patients who have any sort of a disorder. It can also cause non-immune hydrops. In fact, it's the most common cause of non-immune hydrops. Okay, so this is about parvovirus. Apart from that, two last images. So this is about Japanese encephalitis. This is a very important image. Humans are dead end host. Pigs here are amplifiers. Culex mosquito is the vector, and RD'd birds, aquatic birds like waterfowl are the reservoirs, right? So these relations you want to remember: pigs amplifier, culex vector, humans dead end, and water birds are reservoirs. Influenza will cause two phenomenon by which it tends to infect us again and again. So when there is this diffuse changing, this complete reassortment where two viruses will merge and completely flip the genome, what is this called? This is called as reassortment, and reassortment is producing antigenic shift. Remember, SR, senior SR, antigenic shift. So when such major changes happen, we will have pandemics and epidemics, right? On the other hand, when chote point mutations are happening, point mutation will cause antigenic drift. So here you want to remember Deepika Padukone, DP, senior DP is what you want to remember. Drift, point, reassortment, shift, and these will cause minor epidemics here and there. Okay, so this is what influenza does. So that is what I had for you. 1 hour, I think, good enough time to revise entire micro. This is the fastest that we've ever covered microbiology. So congratulations to us all. Hopefully we can revise all 19 subjects this way and it will be useful to all of you. So thank you so much. I will let you know when the next class is, and yes, I will post the PDF soon before you tell me, and just have some patience. I will post it very soon. Okay, thank you so much guys. Keep studying and um, revise well, and I will see you all again. Thank you so much.